The cases in our area here remain modest. If you take the CDC's categories that they make, it would be still substantial. But these were numbers that were generated before the pandemic, and they're the metrics that go with that. But yeah, we're still seeing cases. We're still seeing people hospitalized. I predicted that would have a little bit of a sweet spot in the first couple weeks of December with a low case number. It looks like we already hit our sweet spot, actually, probably last weekend. Since then, our cases in our region, the Triad region, and also to the west and to the south and to the north, have started to increase again. We hit a nadir of 12 last Friday, and now we're up at 18 per 100,000 per day. Here in Forsyth County, Guilford's about the same. Wilkes County is around 30 per 100,000 per day, and same with Surrey and Stokes in the 20s. So things are starting to go up again. So I think we hit our nadir. Our sweet spot is over, and we'll start seeing our cases go up. Now, will this be like it was last year at this time? No. In fact, if you look at the number of cases on November 18 from last year, and you look at our November 18 this year, we're about a fifth of what we were last year at this time. And the very sharp exponential increase that we saw last year is not happening this year. It's more of a kind of a creep up rather than that. And I don't think we're going to be like what we were for our Delta wave. I think that's over. But they'll go up for respiratory viral season, and they'll be mixed in with flu, and they'll be mixed in with other respiratory viruses. So it's going to be kind of a tough respiratory viral season, particularly for the healthcare sector. And it started early this year. Over 100 cases now of influenza have been recorded in the last 2 weeks at Wake Forest University, and that's very similar. A lot of other universities in the Midwest and up and down the East Coast are seeing outbreaks of influenza on their campuses. In fact, COVID, though, at Wake Forest remains a very rare event, actually. In fact, the influenza to COVID ratio is about 50 to 1. So it's going to be a tough flu season, and COVID will still be around.